Have you ever wondered if the pills you take every day could be quietly affecting your memory? Imagine waking up one morning, searching for your keys, and realizing you can't remember where you put them, or worse, forgetting the names of your loved ones. It's a frightening thought. But for millions of seniors worldwide, this is a growing reality. Today, we're diving deep into a topic that could change the way you look at your medicine cabinet forever. 9 popular medications that may trigger rapid dementia. And trust me, you won't believe what's on this list, especially the last one. Dementia now affects over 55 million people globally, and that number is climbing fast. Every year, nearly 10 million new cases are diagnosed. But here's the shocking part. While most people think dementia is just a part of getting older or something you inherit, the truth is far more complex. Medications, yes, the very ones meant to help us, can sometimes be silent culprits, quietly chipping away at our cognitive health. If you or someone you love is over 60, this information could be life-changing. So why are these medications so risky? As we age, our brains become more sensitive to changes in chemistry. Many seniors take multiple prescriptions, increasing the chance of dangerous interactions. Some drugs disrupt neurotransmitters, those tiny messengers that help our brain cells communicate, leading to memory loss, confusion, and even rapid cognitive decline. But don't worry. By the end of this video, you'll know exactly what to watch out for and how to protect your brain. Let's jump right in. Here are the 9 medications every senior and their caregivers should know about. And make sure to stick around for number 9. It's hiding in plain sight in many homes. 1. First-generation antihistamines. Do you reach for allergy pills like diphenhydramine or chlorpheniramine? These first-generation antihistamines block acetylcholine, a neurotransmitter vital for memory and learning. Studies show that long-term use can increase dementia risk by a staggering 50%. The scary part? Symptoms often start subtly, maybe a little forgetfulness or confusion, so they're easily mistaken for normal aging. If you're using these medications regularly, it's time to talk to your doctor about safer alternatives. 2. Benzodiazepines. Prescribed for anxiety or insomnia, drugs like diazepam, Valium, and lorazepam, Ativan, can be a double-edged sword. They work by enhancing GABA, a calming neurotransmitter, but over time they can dull memory and slow thinking. Research links long-term use to a 50% higher risk of Alzheimer's disease. Seniors are especially vulnerable, as these drugs can cause confusion, falls, and even worsen existing memory problems. If you're on benzodiazepines, don't stop suddenly, but do have an honest conversation with your healthcare provider. 3. Proton pump inhibitors, PPIs. Used for heartburn and acid reflux, medications like omeprazole and lansoprazole might seem harmless. But did you know they can cause vitamin B12 and magnesium deficiencies, both crucial for brain health? Recent studies suggest that long-term PPI use may raise dementia risk by up to 50%. If you've been taking these for months or years, ask your doctor if you still need them, or if lifestyle changes could help instead. 4. Antipsychotics. These are often prescribed for behavioral symptoms in dementia or mental health conditions. While they can help with agitation, they also come with serious risks. The FDA warns that antipsychotics can increase the risk of death in seniors with dementia. Long-term use can worsen memory, cause confusion, and even lead to dependency. If you or a loved one is on these medications, regular reviews with your doctor are essential. 5. Sleep aids, Z-drugs. Struggling to sleep? Medications like zolpidem, Ambien, and azopiclone, Lunesta, might help you drift off, but they can disrupt deep sleep. the kind your brain needs to process memories. Long-term use is linked to a 50% higher risk of dementia. Plus, these drugs can leave you groggy and confused the next day, increasing the risk of falls and accidents. Consider non-drug sleep strategies, like a calming bedtime routine or gentle exercise. 6. Tricyclic antidepressants, TCAs. Older antidepressants like amitriptyline and doxepin are still prescribed for depression, anxiety, and even pain. But they block acetylcholine, just like those first-generation antihistamines. Higher doses mean higher risk, confusion, memory loss, and a greater chance of developing dementia. If you're taking a TCA, ask your doctor about newer antidepressants with fewer cognitive side effects. 7. Bladder control medications, anticholinergics. Medications for overactive bladder, such as oxybutynin, can significantly impact memory and learning. Recent research shows that long-term use is linked to reduced brain volume and slower memory recall. If you're noticing more senior moments since starting these meds, it's worth discussing alternatives with your healthcare provider. 8. Statins like atorvastatin and simvastatin are prescribed to lower cholesterol and protect your heart. But cholesterol is also vital for brain health. Some people on statins report memory problems and trouble concentrating. While the evidence is mixed, if you notice cognitive changes after starting a statin, don't ignore them. Bring it up with your doctor. Sometimes a simple adjustment can make all the difference. 9. Anticholinergic combination medications. Here's the one you might not expect. Many over-the-counter products, think cold medicines, sleep aids, and even some pain relievers, contain anticholinergic ingredients. When used together, their effects add up, dramatically increasing dementia risk. One study found that high cumulative use raised dementia risk by 50%. Always check labels and ask your pharmacist if you're unsure. Now, you might be wondering, what can I do to protect my brain? Great question. Start by reviewing your medications with your doctor or pharmacist. Never stop a prescription on your own, but do ask if there are safer alternatives. And don't forget the power of nutrition. Foods like blueberries, fatty fish, and leafy greens are proven to support brain health. Even small changes, like adding a handful of berries to your breakfast or enjoying salmon once a week, can make a big difference. Before we wrap up, remember, knowledge is power. By staying informed and proactive, you can take charge of your cognitive health and enjoy more vibrant years ahead. If you found this video helpful, please subscribe, like, and share your experiences in the comments below. Your story could help someone else. Thank you for joining us on our Years Matter Healthy. Together we can build a healthier, brighter future, one smart choice at a time.